Let me start by acknowledging the very important work the Honorable Ministers of Health are doing in terms of re-energizing the rest of the health sector. I think it's become clear to all of us that we will have to learn to live with this virus for some time to come. And living with it means not only saving lives from the virus, but saving lives from all the other things that afflict us. So we must keep our primary health care working, which is why the work of the National Primary Healthcare Development Agency has become more important than ever before. We must keep people on antiretrovirals on treatment, which is why the work of the National Agency for the Control of AIDS is more important than ever before. And we must not forget that our fragile national health insurance system needs to continue evolving. So all those bits and pieces across the health sector are extremely critical as we come to terms with the reality that we face. Having said that, I want to focus a little bit today on Nigeria's response in the global context. Over the last few days, there have been a lot of, very emotional and actually correct, to some extent, statements about looking inwards. And there's nothing more important that we should do than look inwards. But we must also remember that this is not a Nigerian outbreak. It's a global outbreak. And we have to engage globally. That global engagement starts from science and understanding the factors driving this outbreak in Nigeria and globally. And as we watch TV every evening, we have seen where science has come in conflict with politics. And I'm actually very proud that in Nigeria and in the political leadership of Nigeria, that our leaders have actually listened to the science and used the science to drive action and based the entire response in Nigeria on the science as we understand it. And as we look globally, it's not enough to look at the countries who have the privilege to transmit to our sitting rooms every day. At the Nigeria Center for Disease Control, I tried to push the team to look at countries like India, look at countries like Brazil, at Mexico, that share a similar demographic to us and face similar challenges. We've been intrigued over the last few days of a big prison outbreak in Colombia, where 30 to 50% of the prison inmates in Colombia have been tested positive for COVID-19. And what does that mean for us and our preparedness? And how do we now have to start adapting our response and preparedness to these new circumstances? In Mexico, there have been large numbers of healthcare workers infected. Now, of course, it is sad for a healthcare worker to be infected. They are on the front lines. But the bigger impact is that it has now caused staff shortages across the health sector, that the hospitals and clinics are now unable to provide the care that they need to provide. In Chile, intensive care has almost completely collapsed because capacity has been exceeded. So these are countries we need to look at because of similarities in demography, similarities in population density in their cities, and similarities in terms of population profile. And that is what we kind of try to do, and we're trying to do now. So slowly, we are rethinking our response at the Nigeria Center for Disease Control from one of just going around and trying to subdue the impact of the outbreak to one that's increasingly science-led, evidence-led. We want to dig deeper into what is driving this outbreak in certain parts of the country and use that to inform the response. So how has this changed our work? Over the last few days, we're beginning to focus a little bit more on the research side of things. We've brought together TEDFund, the Nigerian Universities Commission, under the leadership of the Honorable Minister of State for Health, to start thinking about what are the research priorities for us in Nigeria and how can we drive this research, not just in the long term, but also in the short term. And how can we now use this to improve our own guidelines, improve our training, and become a point of reference for our own response. We're participating in the World Health Organization Solidarity Trial. What does a solidarity trial mean? It means that no country on its own will have sufficient cases and interventions to have the scope of a study needed. So you bring together the data from different countries and pool them into one big study. And that's why it's called a solidarity trial, because we're all working together to the same output. We've shared our initial sequencing of the first viruses, and many colleagues are doing a lot more of that. We've just started a study called the first few hundred cases, and a protocol adapted from WHO's protocol, which we will share with many other countries. So we're working with ACEGID, with NIMA, with the Center for Human Virology and Genomics, the Center for Human and Zoonotic Virology at LUTH, and many other partners in the academic sphere to start thinking about how do we develop our response further. We're also activating our influenza surveillance network so we can use that to base a new surveillance system that will try to estimate the incidence of COVID in patients just coming to hospitals as they would normally come with respiratory infections. Now, why is all of this important? Why do we need the science, and why do we need to engage globally? You know, the end of this outbreak will come when we get a vaccine. But getting a vaccine doesn't mean inevitably that we will have access to it. We have had a vaccine to human papillomavirus for the last 10 years. But because this vaccine costs about $50 per shot, we don't have access to it in Nigeria. So we have to engage globally to insist on equitable access to these vaccines when they are developed. We will not do that by looking inwards. We'll do it by engaging globally, by making the case for access to these vaccines. We must engage globally to have more access to diagnostics. That is one of our biggest bottlenecks now. Why don't we have access? Because the market for diagnostics is skewed in such a way that access is a big problem for us down here. We must fight to have more access to therapeutics, to medical countermeasures, and to everything we need to fight this disease way into the future. This is why we need to engage globally in a lot of these things. So as we look inwards, we must also look outwards. No country can solve this problem on its own. We have to work with others on the science, on global health politics. We need to come together as a global health community. And we can only get out of this if we know and believe that we can only be stronger together. Thank you.